just ask some basic questions. So I don't know if they're coming back in. Anyway, so just a conversation because you're not an actor. We're just going to talk, right? Nobody's an actor except for actors. So let's start maybe with the idea of continuity of care and how ultrasound can be ultrasound at the point of care can be an important part of continuity for a patient who's coming in. Continuity a patient that's coming into a facility and that point of care device being and the information from it being available at all phases as the patient moves through maybe admitting through being placed in a room or in an OR or whatever. What's that looking like these days with the capabilities of ultrasound and IT?
Yeah. So when you take a look at point of care ultrasound, 20 years ago it didn't exist. And ultrasound was really designated for cardiology or radiology. What we've done at Sonosite is focused on bringing ultrasound literally to the point of care, wherever that is in the hospital or institution. So when we think about the continuity of care across the hospital, it's really important to have a few things. Number one would be consistency of user interface. Number two, reliability of equipment. You need to make sure that piece of equipment's going to work well. Number three, these are not safe environments. These are difficult environments to be working in ultrasound or with ultrasound. So durability, the ability to work in harsh environments is really important. And the continuity, it's really important to think about how traditional medical records have flowed through the system. It's been in a really structured, ordered manner. What we do in point of care is anything but structured or ordered. So what we've done is focused on developing not only equipment, but informatics and workflow solutions to accommodate this complex work environment in point of care. Everything from archiving to billing to having the work list on the piece of equipment, the ultrasound system, and most importantly, risk management with accreditation and making sure that your staff has a process to review studies and to document who has done what studies and if they're accredited or not in your institution. So I think that is the continuum of care for point of care ultrasound.
Very good, very good. Let's talk about how ultrasound is addressing the opioid crisis with nerve blocks and so forth. You guys are on the forefront of this. More and more pain medicine folks, surgical folks, emergency room folks, anesthesiologists are recognizing the value of this. Tell me about where this is going.
But we're lucky to be here at the ASA, the American Society of Anesthesia meeting in San Francisco. I just was speaking to some customers who are telling me about how excited they are for nerve ultrasound, how excited they are.
Start again.
Yeah.
So where is this going? The whole opioid management through ultrasound? You can start again. We can cut part of that so you can just continue your thoughts.
What's exciting about ultrasound-guided ultrasound for nerve blocks is this is really, hold on.
Okay, yeah. Just a conversation.
Yeah.
You don't try to remember what you want to say. Just talk to me about it. Because know the answer.
Yeah.
I want the answer from you.
Yeah.
To me.
So, okay, to you. Am I supposed to look at, can I look at you or am I?
Yeah.
or-
And I'll just kind of
Okay.
hang down that.
Okay. So what's exciting about ultrasound-guided nerve blocks for ultrasound-guided nerve blocks is this is really part of the solution for opioid reduction. If you think about the majority of money and funding that's being spent with opioid reduction, it's on the therapy and on the recovery of people who are already addicted to opioids. What we're part of the upfront solution so that the patient never needs an opioid prescription. If they have that if they have that ultrasound-guided nerve block, the patient is in comfort during the procedure. They're released from the hospital quicker, and the procedure goes better, and they never are exposed to the opioids in the first place. No one wakes up in the morning one day and decides to try heroin. It's a progression that starts in the hospital after these procedures. And if we can avoid the upfront prescription, we will see a tremendous decline in opioid reduction in this country and worldwide.
Great. So if you could say just kind of a quick statement about the fact that something on the order of, you know, partly through your education
Yep.
component of the company, you are educating doctors, and KOLs are educating, you know, your KOLs are educating other doctors about this, and it's starting to proliferate, and the understanding of using nerve blocks is,
Yeah.
it's being embraced as a solution.
Yeah, absolutely.
Something like that.
So one thing that's exciting is as physicians and anesthesiologists start to practice ultrasound-guided nerve blocks, you can feel the excitement in this community to learn and be educated. I'm excited that Sonosite's a part of that education cycle to enable this conversation and start training and educating the anesthesia community on how to deliver successful ultrasound-guided nerve blocks and avoid this and to avoid prescriptions of opioids, eliminating the first step in the addiction cycle.
Great, great. You could maybe take it from, again, just to say we're excited that our technology is helping to avoid the need to prescribe opiates in the first
Yeah.
place, something like that.
Yeah.
So we could edit that back in.
Okay.
Just something like 10 seconds.
Okay. So we're really excited to see our technology being used as the first step in avoiding the prescription of opioids and reducing the opioid epidemic
It's okay.
and reducing the.
You just do it again.
Okay.
Yeah.
So-
Just don't remember what you're saying there.
Okay.
Just you know, if you were saying it to your kids. Yeah. Yeah.
Right. So we're excited that we're able to play a significant part in educating our customers on how to deliver ultrasound-guided nerve blocks in order to avoid the first part of the opioid epidemic, which is the prescription of opioids in the first place.
All right, so the opioid topic, education. So you guys are kicking off the next version of the Institute, and you have brought the industry sort of an amazing
Yep.
tool, like, you know, on demand. I mean, you guys are way ahead, and in fact, we talked about the fact that we're gonna get an article in Chief Learning Officer magazine,
Yep.
which is really cool. But you guys have really hit it out of the park in terms of like customer education. So that saves them money, it saves time, they can connect with each other, they can learn from each other. You've created an ecosystem of learning
Yeah.
How did you do that?
So a lot of this was out of necessity. When we brought ultrasound to the different disciplines in point of care, we discovered that most of our customers weren't traditionally trained in imaging, weren't traditionally trained in ultrasound. But we're really hungry for learning and education, and in particular, best practices on how to do different procedures in ultrasound. We thought about what's the most effective way to do this, and a lot of this is done through having our customers champion the different learning segments that are in the Sonosite Institute. So a lot of what you'll see are webinars or easy to learn videos of us working closely with our customers to bring this incredibly rich content to you at a click of a button. It really is on-demand learning, best in class from the experts in every one of the fields, so you can quickly and easily learn about the different procedures, different anatomies, different parts of ultrasound that most people do not know and haven't been trained on in medical school or in the residency. But you can become an expert on just about any field in ultrasound using the Sonosite Institute. And this is a complimentary service that you get with the purchase of a Sonosite ultrasound.
Do you guys have any sense of what it costs? Like if I'm a facility and I had to do my own training, or I had to go out and buy training from a training company, what would it cost me to say, with all these people that handle point of care ultrasound, so it's lots of places in the hospital, right? It could be $50, $100, $200,000.
Yeah. Easily. So if you think about what the cost of training, flying experts in, and paying for time and content, you're looking at thousands of dollars a day. So easily this institute, Sonosite Institute, could be saving an average customer anywhere between $50, $100, or even more per year. It really depends on how much of the institute content our customers are using on an annual basis. And with the launch of our new Sonosite Institute, we are convinced that we'll see more and more value because the content is easier to get than ever, and the site's much easier to navigate. So we're very excited about that.
Great. How long has so I've been involved with the company a long time, and I know there's always been this education component. Did it start with pretty much at the outset of Sonosite? It's really always been there, right?
It has. So education has always been one of our pillars. When you think about point of care ultrasound, some of the important components are going to be, is the ultrasound machine easy to use? Is it simple? Is it durable, reliable? But then we noticed that education needs to be one of the pillars as well, because our customers aren't traditional sonographers. They haven't been trained in ultrasound. So it's an important component. That's why you will not only see tools like the Sonosite Institute, but you will see the best clinical specialists in the industry available for our customers as well. So we've invested a great deal to ensure the success of our customers on a daily basis.
That's a great thought. So there's another area that I wanted to touch on. Well, we did the article on the total cost of ownership. Without having to recount the details of that, I think a lot of people don't understand that they don't know how to calculate the total cost of ownership. And one of the big components is, is the warranty really robust?
Mm-hmm.
Are they taking, as they say, sometimes people say, I could afford to buy that house, I just can't afford to own it, right? Because the maintenance is high and all of that. So you guys have the leading warranty, and that's a big piece of total cost of ownership. maybe just give us a couple of thoughts about that.
Yeah, I think it's really important for us all to peel back the covers of a warranty. We were the first in the industry to come out with a 5-year warranty. We did that because we're tremendously confident in our product, the quality, and the reliability of our systems. When you think of a total cost of ownership, a lot of times customers look at the upfront acquisition cost, which is only a small portion of it. You have to then start peeling back, well, is it 5 years? If it is, not all 5-year warranties are the same. Does it include, does that warranty include protection for probes and the entire system? Is the warranty, does it include a loaner? Is the loaner available? All those other elements to keep your practice up and running. I also think in total cost of ownership, you have to think about who is the market leader and what the trade-in value is at the end of that life of that system. As market leader, our Fujifilm Sonosite systems traditionally have a much higher trade-in value than others in the industry.
Part of your total cost of ownership goes to your heritage about, you know, the battlefield ready, that durability. You guys can say probably more than anyone that your system's super durable and that it can take a beating.
Yep.
And not really break.
Yeah.
So say a little bit about that heritage.
Yeah, the heritage is battlefield ready. We were born out of a DARPA grant, which means we were born out of the battlefield. If you think about the conditions that our systems have to meet, where it could be water testing, drop testing, very rugged standards. It's the most I've ever seen in this industry. Our products are fantastic, and I love hearing stories from our customers about the number of years they've had our systems without a service incident. It's incredible, even with our warranty, how many of our systems have never had to actually use the warranty that they've had.
Tell me a little bit about your philosophy of being innovators and creating that culture of innovation. And you know, you guys come from you know, the Jacques Souquets, the Kevin Goodwins, you know, the people who are like really smart
Yeah.
in business and also innovative product guys and ultrasound geeks.
Yeah.
Right. So it's really been with you from the beginning, but how do you keep that innovation going?
Yeah.
What are those? What's that secret sauce that you as a leader have to continue to, you know, continue to facilitate?
Well, we have a great legacy. 20 years ago, we created the first point-of-care ultrasound system. And if you think about what we've had to do, it's exactly what we continue to focus on. And that is developing the best technology for point-of-care ultrasound. What that means is that we have to look at what are the minimum necessary components to get a relevant answer for our customers, and that's how we build our products. It's much more difficult to say what you're not going to include in products than what you are in just adding everything into the product. A lot of our competitors start from a premium system and start figuring out what features they want to peel off to make it a point-of-care ultrasound. What we do is we figure out, by working closely with our customers and keeping the customer at the center of everything we do, precisely what they're looking for and what answers they need to have the best patient care at the point of care.
And your KOLs are like development partners, right? I mean, it it is like, I mean, my observation over the years is that these are really close partnerships. I
Yep.
mean,
Yep.
it's like co-development.
Absolutely.
With the smartest doctors in the industry.
Yeah, we're lucky to be working with passionate customers/partners who really care about the industry that they're in. So these customers come into Seattle on a regular basis. They work with us, they work with our engineers, they work with our planning departments and start talking about not only our current products, but they help us see over the horizon about what trends they see and what they need to be built into our systems in the future to make sure that they have the tools to not only do what they currently do, but to do the procedures that they want to do and what those healthcare trends are.
So, forgetting the market for a minute, if you had to say to your team of very talented people, where are we going? How are we going to get there? You know, and maybe even give them a call out for
Yeah.
what they've done. What would you say?
Yeah, I'd say you guys have been the market leaders. You haven't got there by accident. You've done that deliberately by listening to our customers, keeping our customers at the center of what we do. And you're committed. When I look at the Sonosite team, I've never seen another group of people in the industry who are as passionate not only about what they do, but about the communities that they live in and they serve and their customers. And what we want to do on a daily basis is be the best so that we're able to help our customers, the caregivers, provide the best patient care possible in all of the communities throughout the world. That's what gives us passion. That's what makes us the best. And that's what will keep driving us to be the market leader for years to come.
Very nice statement. Very nice. That's something I think you could show you know, somehow, or we can build on that, or whatever. Is there anything that you, anything you want to communicate either to the marketplace or to the employees or, you know, anybody else about, you know, the trajectory of, even just point of care?
Yeah.
You know, the fact that you've started this, but it's proliferating, and
Yeah.
you've gotten over that, the turf wars. And
Yeah.
you know, you guys have made it possible for everybody to become ultrasound literate.
Yep. Yeah, no, I think, so the statement I want to make is that as well as we're doing and as much as we think we're helping our customers, the strongest competitor that's out there is still the non-use of ultrasound. We have a lot of work to do by creating more knowledge about what ultrasound can bring to the different disciplines and what we can do to make patient care better. What I love about what we do, one of the things I'm most passionate about is we are part of the solution in healthcare. We are not part of the problem. We do something that's very difficult, and that is we increase access to care. With ultrasound, we're able to treat a lot of patients quickly. We improve the quality of care. We get the right answers at the right time, at the right place. And we do that by decreasing the cost of healthcare. You think about those three items. It's easy to pick any two of them, but to do all three and do all three well, that's a rarity, and that's exactly what we do. That's what gives me energy every day in the morning, knowing that we're able to be a part of the solution in healthcare. And I hope that motivates you to convert the non-users of ultrasound into Sonosite customers.
Awesome. Man, you're on a roll. I think that's good.